So I'm going to talk to you about the ImpRes tool. But what I'm going to do beforehand is just do a bit of an introduction to implementation science and implementation research in general. So really to give you an introduction to that, understand some of the complexities and challenges, and then introduce you to the ImpRes tool and the ImpRes guide, which has been designed to help people who are designing and running implementation science projects. So what we're hoping to do is give you a brief introduction to implementation science for 10 minutes, then an overview of the tool and guide for about 25 minutes, then a practical example of using ImpRes for about 10 minutes, and then hopefully we'll have about 20 minutes for a Q&A. I'm going to start though with just to ask you to think about a time at work when you were asked to either do something new, stop doing something, or change something that you did. And I just want you to have a think for a minute about, did you change? Did you stop? Did you stop doing things? If you did change, what helped you to do that? If you didn't, what stopped you? And how did you feel about that? And I'm asking you this because for me, this is kind of what implementation science is kind of about. It's about helping people to change what they do, not just in a health setting, it's used in lots of other settings, but obviously my kind of background is in health settings. And one of the things that we know is that change is really difficult, whatever it is. And so implementation science is what is trying to do is to help with that. Now, one of the big issues that we know is that the reality of research into practice is a tricky one. So there's evidence from about quite a long time ago now that the gap between research being done, providing good evidence, and then actually being put into practice is about 17 years. Now, obviously, this will depend on, what area it's in, what the intervention is, and things like that. But that's a really long time, as you can see, and actually, it means that patients aren't necessarily getting the best treatment that they can get. So it's a real big issue. There's also the waste around that. So there's a lot of time and money spent on developing evidence. So then for that to not get implemented into practice is a huge waste of money and time. And I'm sure that you probably have got your own examples of this happening in the areas that you work at. And you can see here a quote from the World Health Organization to say that implementing evidence-based practices is one of the biggest challenges, and that implementation science is important in helping to do this. So what stops evidence being put into practice? And again, I'm sure that you will have your own examples of this. This is just some of the ones that we know about. So there's so many competing demands on frontline providers, and I think that seems to get even bigger as time goes on and resources are more limited. There's a lack of knowledge, skills and resources about how to do this. Research evidence isn't always aligned with the priorities of different organisations or individuals. And the big one that people often and always come back to is time. It's really difficult for people to have the time to do these things. So one of the things that implementation science is trying to do is to think about how do we close that gap. And these are a couple of definitions of implementation science. So it's about the scientific study of methods to promote the systematic uptake of clinical research findings and other research evidence-based practices into routine practice, and hence to improve the quality and effectiveness of health services. So I think that's always really important to remember why we're doing this. It's about improving what services do and the outcomes for patients. And then that second one is talking about supporting innovative approaches to identifying, understanding and overcoming barriers to the adoption, adaptation and the rest in terms of evidence-based interventions, but also things like tools, policies and guidelines that it's the same kind of process usually. This is a less kind of formal definition. This is by Jeff Curran, who is a well-known figure in implementation science. And I think he was trying to think about how do we explain implementation science to people who aren't in the field. So he talks about the intervention or the practice or the innovation is the thing that you're trying to do. Effectiveness research looks at whether the thing works. And then implementation research looks at how best to help people to actually do the thing. implementation strategies are what we do to try and help people to do the thing. And when we're looking at implementation outcomes, we're looking at how much and how well they do the thing. So you can see, I hope, that the implementation research is different to effectiveness research. So effectiveness research is looking at, does the thing, whatever that is, it could be an intervention, does it work for the patients? And then implementation research is trying to understand, what do we need to do to make sure that the thing is actually implemented and implemented well, so that we can understand how things have been implemented. So implementation science aims to develop strategies for improving processes and outcomes, to produce insights and knowledge regarding those processes, but also barriers, facilitators, and strategies that can be used, and then to develop, test, and refine implementation theories and hypotheses, methods, and measures. So just to look at the differences again between effectiveness and implementation. So normally you can see here you've got different aims, different units of randomization, typical units of analysis would be different, and the outcomes of interest are different. But they're all important. So, you know, we want to make sure that something works. We want to make sure that it can be implemented. But actually what's really helpful is to think about it at the same time. And I'm not going to take a huge amount of time on this, but this is quite a big part of implementation science, is what we called hybrid designs. So there are effectiveness and implementation designs, and Jeff Curran, who I just quoted, is again someone who's done a lot of work in this area, and it's looking at how you can bring together effectiveness and implementation research, so that you can do this at the same time, which I think gives a lot of gains. So it's quicker if you do it, rather than doing it one and then the next, you do it at the same time. It can really help you understand implementation strategies and gives more useful information for decision makers. And I apologise for the noise in the background here. So this is just to give you kind of an idea of sort of where on the sort of research pipeline hybrid trials and designs would fit. So you can start off with the clinical efficacy research, you can look at the clinical effectiveness research, then you've got the implementation research, and you've got improved process and outcomes. And where you can bring that all together is with the hybrid designs. And there's 3 different types. I'm not going to talk about them now. There's a lot of kind of research on this. So if people are interested, I can certainly send papers about it afterwards if people are interested. But just to know that often in implementation trials, we're looking at hybrid design. So we're looking at both clinical effectiveness and implementation at the same time. So in terms of designing implementation research, it's still quite new. Implementation science as a field is probably, you know, less than sort of 30 years old. And it comes from lots of different backgrounds. So it's a very pragmatic field, and it's really brought together ideas and research from psychology, from business, from clinical research, but really trying to, you know, do it in a much more applied way to understand how we can implement things well. It's been described as a growing but not well understood field of research, and that's from, you know, over 10 years ago. So hopefully it's a bit better understood now. But also we know that design and implementation research can be complex and daunting. Concerns have also been raised about, well, what guidance is there for people that want to do implementation research, especially people who are clinicians who are often really interested in this, because they want to understand, well, okay, I've got this intervention or I've got this process, but I want to understand how best I can implement it so that it's successful. And so there's guidance that's been designed, and you can see these 2. There's something about implementation strategies and something that looked at theories and frameworks. And it's a real problem. So this paper that came out in 2018 found that actually projects weren't really reporting very well what they were doing. They were often actually really looking at effectiveness rather than implementation, and they weren't really looking at improving uptake. So it feels like there's a big gap. So my colleagues, including Louise, I wasn't part of designing the ImpRes tool, but they decided that actually something like ImpRes would be helpful to look at consolidating guidelines and recommendations that were already out there, and to provide researchers and practitioners with a more systematic approach to guiding the design and the evaluation of implementation research. So the development of ImpRes was multi-stage. There was experts from the field involved in brainstorming and consensus building and a scoping of the literature. And the tool and this paper came out in 2018. And so now what I'm going to do is tell you a bit more about ImpRes, what's in there, a bit more about the guide. It's freely available, and I can send the links through. So within ImpRes, there are 10 core domains, and all of these need to be considered when designing implementation research. Some of them will be more or less applicable, and it may be that some of them you decide that you don't do. But it's good to recognise that you need to think probably about these things, even if it's just to kind of think, actually, for this particular project, I don't need to think about this, but I need to be aware of it. So the first one is just to help you to think about the characteristics of your research. So for you to think about and articulate the implementation questions and aims. So for example, you could have a new intervention that you want to try out in a couple of different places. And actually what you're interested in is, well, what are the things that are going to be the barriers, and what are the things that are going to be facilitators to help to implement and, as importantly, sustain this intervention? Or you might want to identify the implementation determinants. So that's when you're thinking about the implementation of determinants are the things that are going to be the barriers and facilitators for your project. And then you might want to think about what's your design, and there will be, you can use any kind of design. Implementation science doesn't suggest any. But it's more about thinking about what's the data that you need to collect to be able to answer your research questions. And then think about where is your design if you're thinking about the effectiveness implementation research continuum. So you could just have a pure implementation study, or you could look at a hybrid design. And again, there's more details about what we mean by all of that in the guide, so I'm not going to talk about that anymore. Implementation theories and frameworks and models. Implementation science has got a lot of these, and it can be really overwhelming. We do encourage the use of a theory, a framework, or a model, because we think it helps people to really think about what you're doing and understand what you're trying to look for, but also to think about why you choose the theory, model, or framework. So for example, this figure here is from a really good paper that's really trying to help people to think about what they want to use, and it helps to think about what is the framework or theory or model going to help you to do. So for example, there are what's called determinant frameworks that can be used to help you to identify barriers and facilitators, and I'll show you an example of this when I talk about the use of ImpRes. Determinants of implementation. So this is thinking about what factors are likely to affect implementation, and so what we're really trying to do is encourage people to think really systematically about trying to identify the factors that they think are likely to hinder or facilitate, and have a list of them which you can get from either the literature, from your own experience, but also in talking to people. So, if you're developing something that's going to be used in a particular department of a hospital, what do you need to be aware of in that department? That is the culture of that department, but also the culture of the organisation that is going to impact on how well you're going to be able to implement something. It also encourages planning adaptations and modifications to the intervention, and also how you describe and justify them. So you might decide that some of your implementation strategies are going to be doing training sessions for people, for example, but you might find that because of resources that you have to reduce that. So it's just about being really clear about what you plan to do and then what you've actually had to modify and adapt to in the work that you're doing. And I think we probably all have examples of knowing that you go in with ideas, but actually often they do have to be adapted and modified because of what you're finding. So implementation strategies are the things that you do to enhance the adoption, the implementation, and sustainability. And there's a lot of work that's been done on this. The Proctor paper in 2013 is the kind of the paper that usually people go to because it lists implementation strategies, and it helps you to think about, okay, what are the strategies that I'm going to use in my particular implementation project. And so often they will be about training and educating stakeholders, or it could be doing audit and providing feedback. There's a whole list of strategies. I think there's something like 73. You're probably not going to want to use 73. But you might want to have a look at that list and think, okay, which are the ones that I'm going to use? Think a bit more of how you're going to do that, and have a plan for that. So you're really providing justification and a rationale for the implementation strategies that you're going to use. The next bit is about service and patient outcomes. So obviously this is really important in looking at clinical effectiveness, but they won't help you to understand implementation effectiveness. So actually what you're wanting to do in an implementation study is really to think about outcomes that aren't just the patient outcomes, but are the service outcomes as well. So the main thing that we're looking at in implementation research is implementation outcomes. And again, there's been lots of work on this, and there's a Proctor paper from 2011 that lists them. But what we're really thinking about in terms of implementation outcomes are what are the things that support people to actually implement things. And what we're really interested in often is people's experience of the implementation. And so these three things: acceptability, feasibility, and appropriateness are the main implementation outcomes that we look at. So how acceptable is this for people? So how satisfactory is this for people is usually the question that we're asking. In terms of feasibility, so in your particular department or organization, you might have this great intervention, but actually, is it feasible? You know, do you have the resource to do it? And that's obviously going to have an impact on whether you're able to implement it or not. And how appropriate is it, both for your organization, for your service, and for the people that you're doing it with, for your patients? And so you might want to do some work to understand that. And often that will be qualitatively using interviews or focus groups or surveys. There are also some quantitative measures where you can ask people to fill them out, and they're quite short and easy to use. You also want to think about what's the level of analysis that you're looking at, and what's the stage of the implementation. So you might want to do something before you start to understand whether your intervention is going to be acceptable and feasible and appropriate. And then throughout your study, you might want to kind of build in data collection for all of these things so you can understand, you know, is this still acceptable for people? Are there things that we need to change? The next part is an economic evaluation. So obviously any implementation is going to use resources, and that's usually sort of time, but it can be other resources as well. And so ImpRes has got a section in there looking at both the implementation project costs, so how much of the project labour, you know, clinicians' time away from clinical practice, training, things like that. The cost of the intervention, and also the health benefits. Now, I'm not a health economist, and whenever I've done economic evaluations, I've done it with a health economist, but there are some things that I think you can do quite easily. You know, you can think about, okay, what's the staff level of the people that we need to be doing this? Let's work out how much of their time we're using, so you can do your own, you know, quick and easy implementation evaluation to understand how much it costs. Another thing that implementation science thinks about is unintended consequences. So I think whenever you do a new intervention, or you change something, or you implement something new, there may well be consequences that happen that you're not expecting. And this can happen in any kind of research trial, but often they're not really reported or studied. What implementation science is really interested in is what are any unintended consequences, and they can be both positive, so they can be good things that you're like, well, this is a really good thing that's happened, so we're kind of happy with that. They can be negative things, so you might want to think about, okay, we weren't expecting that to happen, what can we do to either, to mitigate that, or it could be something that's kind of neutral, where you're kind of like, okay, this is happening, not really making any impact, but we'll just sort of bear that in mind. So ImpRes just prompts research teams to be mindful of understanding that. And again, you might want to do that in a qualitative way, where you can ask people, has anything happened that you weren't expected? Have there been any unintended consequences? Stakeholder involvement and engagement is obviously really key. And for me, I think this is probably the most key thing, because if you're asking anybody to make any differences, change what they're doing, if you haven't got that involvement and engagement, then it's probably not going to work, or it's not going to work so well. And I think, really want to encourage people to involve people as soon as you can, involve people in the design if you're able to, involve people in the planning, and then dissemination in all of those parts of the cycle. And then your stakeholders will be, patients, healthcare providers, managers, commissioners, whoever is going to be involved and have an influence in what you're doing. ImpRes also has another section that is just on patient and public involvement, and people often ask why we have this as well as stakeholder involvement, and it's really just about because we understand how important this is, and really making sure that you've got that patient in public involvement really central to what you're doing. And again, that's at all parts of the all parts of the involvement cycle. So that's the 10 domains, and I'm really aware that's been a real whistle-stop tour. When the tool was developed, the researchers did a lot of work with people to use the tool with people, find out how they found using it. And one of the things that people really liked was having this researcher that came along and went through the tool with them. And they realized that actually that's not going to be able to happen wherever anyone is using the tool. So they developed a guide, and the guide has got really good stuff in there. So it's got some, jargon busting, really helping people to understand some of the terms, some tips and hints, links to research, other resources, which is really, really helpful. And both the tool and the guide are being updated at the moment. So there will be a new one coming out soon. So keep an eye out for that. So now what I'm going to do is just go through applying ImpRes, and I'm using an example of a project that I led on, which was a health champion study, which was a study where volunteers were matched with people with mental illness to help them to manage their physical health. And so I'm just going to go through the domains and just talk a little bit for each one about how we used ImpRes. So we used the research, so we were thinking about the research characteristics. So we were thinking about a summary of our research. So what we wanted to do, what were our questions? So our questions were really, this was a new intervention. No one else had done it before. We were using it in a particular mental health trust. So what we really wanted to understand is, well, is this feasible? So we've got this idea, we've kind of involved lots of people in this, but is it feasible? Will patients find it acceptable? And what resources do we need to implement it? We also wanted to know, would it be effective for people? So we did a hybrid design where we looked at both effectiveness and implementation. We looked at, in terms of using a theory, we used the consolidated framework of implementation research, which is a very well used framework in the implementation science. And what the framework helps you to think about is some of these aspects. So it's looking at the setting, both the outer setting and the inner setting. And by the outer setting, we mean the kind of the broader setting. And then the inner setting, we're really thinking about the organization and the teams that you're working in. You're thinking about the what. So what is it that you're actually implementing? And then you're thinking about the people involved, and actually how is this working for them? And then also the implementation process. So how is that process working for you? And it helps you to try and map some of these things, plan some of these things, think about how you're going to collect data on these things. So that was really helpful. In terms of understanding the determinants, so the contextual factors. So what we're going to be, we're thinking about, well, what's the context that we're doing this in? And what are going to be the contextual factors that implement on our intervention? So we were thinking about, okay, we've got an intervention where we're using volunteers. So we really need to think about how do we support our volunteers? What do the volunteers need to be able to implement the intervention? We're thinking about the characteristics of our participants and our volunteers. We're thinking about who we're recruiting from. So we recruited through community mental health teams. So what were going to be the things that were going to help us to recruit with those teams? It was in a large organisation, mental health trust, and then also something that we couldn't predict at the time. We had everything ready to go, and then COVID struck, so we had to really change what we were doing. So that really changed our context, as you can imagine. So we were thinking about what the implementation strategies. So really what we were doing was providing assistance to our volunteers that was very interactive. We did training sessions, we did supervision sessions with them, really developing our stakeholder relationships. So with our volunteers, with the people at the mental health trust, and also our patients, our participants. We did lots of training and educating our stakeholders, and we supported clinicians in understanding what the intervention was and how it was going to support people and what the role of the volunteers were. In terms of our patient and service outcomes, we had patient outcomes. We were looking at health-related quality of life. This is how we measured it, and these were the time points. So it's really quite helpful at the beginning to kind of, map out what your service outcomes are going to be, how you're going to measure that, and when you're going to do it. In terms of our implementation outcomes, we did the same thing. So we were looking at acceptability, feasibility, and appropriateness. We're also thinking about the barriers and facilitators and the unintended consequences. And we did interviews with our participants and with our health champions. And we also used the AIM and the FIM and the IAM are the implementation outcome measures that we used to measure those things. And then we used the interviews as well. And the interviews were really, really helpful in understanding people's experience. We did them at the end of the intervention to help understand people's experiences and what the barriers and facilitators were. We asked people at unintended consequences. We didn't really find any, but we did ask people in the interviews, was there anything that happened that you weren't expecting? We also did an economic evaluation. So we costed how much the intervention cost to implement, which was mainly around staff time and any cost consequences of the intervention. So we were interested in whether if people had a health champion, did that change their use of primary care, for example. I mean, we were lucky we had a health economist who kind of did all of that for us. He told us what data we needed, we got the data for him, and then he did all the crunching of numbers. So we also thought about who our stakeholders were. So they were our volunteers. We were lucky the trust that we did this in had a volunteer service, and they were really supportive. So they were our stakeholders too. And as I said, we engaged them in helping to plan the intervention, during the intervention, and while and our dissemination. And then in terms of our patients, we involve patients in designing and disseminating, and also in evaluating the impact. And they gave us really, really good feedback on, what they thought was important for them for the intervention. So in a summary, and I'm really aware that I've talked a lot and I've given you a lot of information there. So for people that this is new to, it can be complex and daunting. The ImpRes tool has these core domains to review and consider when designing implementation research, which hopefully will help you to plan and think about these things. And the tool and the supplementary guide are hopefully promising resources that people can use.